Hello, my name is Beverly Strong, and I am a psychiatric nurse practitioner student. In this scenario, I'll be discussing a 19-year-old postpartum patient presenting with psychotic symptoms 2 months after delivery. This case explores a psychiatric emergency unique to the postpartum period, postpartum psychosis, which requires urgent recognition, compassionate crisis management, and collaboration across disciplines. In this presentation, I'll explain how I would assess risk, ensure the safety of both mother and infant, engage the family therapeutically, and coordinate inpatient stabilization and long-term follow-up care. My goal is to demonstrate how clinical judgment, empathy, and teamwork come together in managing complex psychiatric crises like this one. This is a 19-year-old woman who presents for her fourth outpatient visit with her husband and 2-month-old baby. Right away, I notice her appearance is very different. She's dressed more provocatively, her makeup is heavier, and her energy level is high. Her speech is rapid, loud, and tangential, and she begins talking about a video series on aliens. She believes her baby is an alien and that she must take the baby to the desert to return it to the aliens. She denies suicidal or homicidal thoughts, but her husband reports she's been acting very differently for the past 2 weeks, and he's afraid to leave her alone with the baby. Given the timing and symptoms, my leading diagnosis is postpartum psychosis. Even though she denies harmful intent, her plan to take the baby to the desert represents imminent risk to the infant. My first step is to ensure a calm, safe environment. I would make sure she has personal space, keep my tone slow and reassuring, and avoid arguing about her delusion. I might say, I can see that what you're feeling and believing feels very real to you right now. I'm concerned for your safety and your baby's safety, and I want to get you somewhere safe where you can rest and get the care you need. At the same time, I would gently involve her husband by explaining that our goal is safety and stability, not punishment or judgment. I'd ask him to keep the baby nearby while we continue talking and let him know I plan to arrange an inpatient evaluation to ensure his wife gets immediate help. Because this is a psychiatric emergency, I would contact the mobile crisis outreach team or non-emergency 911 line to arrange safe transport to an inpatient psychiatric facility. I would not allow her to leave with her husband, even if he had good intentions, because we can't be sure of her stability. While waiting for help to arrive, I would continue engaging her in conversation, validating her emotions, but not reinforcing the delusion. For example, I might say, I can tell this has been overwhelming for you, and I know you love your baby. Let's get you some care so you can start feeling better. I would also ensure the baby's safety and placement with the father and offer social services resources if he is needing assistance with infant care while the mother is admitted. After she's admitted, I would document the encounter thoroughly, her presentation, speech, affect, delusional content, my rationale for emergency hospitalization, and all safety measures taken. Once she is stabilized, I would coordinate interprofessional follow-up. With her consent, I'd communicate with her OBGYN and pediatrician to ensure medication safety and continuity of care. I'd also involve her husband in family education and provide resources on postpartum mental health. After discharge, follow-up would include medication management, psychotherapy, and ongoing family involvement to monitor for relapse and maintain stability. This case demonstrates the seriousness of postpartum psychosis and the importance of early intervention. Even without suicidal or homicidal intent, delusional beliefs can create life-threatening risks for the infant. The key interventions are maintaining calm, non-confrontational communication, arranging an emergency inpatient evaluation, and supporting the family through education and involvement in care. After stabilization, interprofessional collaboration among psychiatry, obstetrics, pediatrics, and social work ensures safe recovery and family reintegration. This scenario highlights that managing crises like postpartum psychosis requires both clinical precision and deep compassion. As a future psychiatric nurse practitioner, I understand the privilege of protecting patients and families during their most vulnerable moments and guiding them back towards safety, stability, and healing. Thank you.